those of you who don't really know about QIAGEN, I kind of want to give you a little bit of an overview of what QIAGEN is and kind of how we help with different AMR workflows. So really our goal nationally and globally is just to advance scientific discovery. And so we have a bunch of different headquarters around the US, as well as distribution partners. So whether you're working here in the United States or abroad, we can definitely help you out. So I kind of wanted to highlight some of our big achievements last year that really pertain to just public health in general, and then we can kind of dive into AMR a little more specifically. But obviously during COVID, the last, from 2020 to 2022, we saw that public health in general was just a really big need that sometimes wasn't getting the focus that it deserved. And so we really stepped up as a company during the pandemic to help with testing demands and like supply chain and things like that during that critical time. So we were actually able to ship over almost 2 million viral sample prep kits between that time for the COVID pandemic. And then, once we saw that kind of, getting a little more attainable or manageable, that's when we saw a little outbreak of Mpox, which, we're actually seeing a little bit of a comeback of. But it was a really highly regulated need. So we needed to ensure that the CDC and the public health partners had compliant kits and instruments and things like that. And so during that small outbreak between 2022 and 2024, we were able to ship about over 300,000 DNA prep kits for that were all validated through the CDC. And we also provided the oligonucleotides, so the primer probes for those tests to all the different public health entities across the US and abroad. You may have heard that wastewater-based epidemiology is kind of making a huge introduction into the public health space. If you're not familiar with what that is, they're actually able to look at your different wastewater treatment plants. They gather samples there and they're able to detect a bunch of different things, whether it's, COVID, flu, RSV. It really just helps monitor and surveil for those different types of pathogens. And you can also look at AMR, different AMR genes, and see how those trends are acting across, space and time, depending on where you're looking. And so I'm going to talk about our QIAGEN instrument, which is our digital PCR instrument. Digital PCR is the preferred method for wastewater-based epidemiology. And 44 out of the 50 states in the US are equipped with our QIAGEN for digital PCR, specifically for wastewater-based epidemiology. And finally, you've probably heard about this a lot. Avian flu is kind of a scary thing to think about right now. It started to emerge early in H1 of 2024. And so we've been supporting different public health entities with sample prep kits and, again, oligonucleotides as primer probes. So we've shipped out in H1 last year about 136,000 viral prep kits for that, as well as provided the CDC with oligos to provide to the rest of the US and global partners. And we haven't hit our H2 number, concluded our H2 numbers yet from 2024, but I expect that to be at least double now. And I also wanted to show this collaboration that we did with the Hawaii Department of Health using that entire workflow that I just mentioned. And so what they did is they wanted to look at different antimicrobial resistance genes across the Hawaiian communities using wastewater-based epidemiology. So they looked at 2 different wastewater treatment plants for 2 different islands in Hawaii, and they processed those samples using our QIAamp All-Prep Power Viral Kit for the extraction. Then they ran NGS on those kits to see, what AMR genes were just present in those samples. And then they saw that the 5 they were most interested in were these carbapenem resistance genes, which I think I showed you in the beginning of this presentation was one of the highest threats to AMR across the US and globally. So they wanted to hone in on the big 5 carbapenem resistance genes that they saw were abundant in their samples. So that's NDM, IMP, VIM, KPC, and OXA48. Those are the ones that are most associated with carbapenem resistance. So they quantified those using the QIAGEN, and then they analyzed that data using the CLC Genomics Workbench. It's really hard to see the results here, but the basic conclusion is that there is a really nice amount of genetic diversity of the carbapenem resistance genes across both wastewater treatment plants. And they monitored this over 18 weeks, and you can see that there were certain spikes in those genes, in the carbapenem resistance genes, that they were able to quantify again with that digital PCR data. And so just really nice correlation there. And they were very similar despite being on two different islands, which is really interesting. And so now that they have this baseline data, they're going to be able to monitor those 5 carbapenem resistance genes over time. And if they ever start seeing any spikes or anything, it can just help facilitate how they're going to let their public health colleagues, the different hospitals and doctors and things like that, know how, it might help them look for what to monitor in those hospitals to be able to prescribe the right antibiotics for, different pathogens that are out there. So it just keeps them in the know of when there might be, some kind of AMR data that they need to let the community know about, which is really interesting.